activities like burning coal. Lead is present at low levels in our air, soil, and water, but it's often very difficult to remediate many of those stores of lead. It's therefore critical to restrict lead exposure in the environment directly under our control, such as consumer products. During the development of the CPSIA, the AAP was asked by Congress to recommend a limit for permissible levels of lead in children's products. The Academy engaged in a rigorous scientific process involving a review of the pertinent literature and ultimately recommended that lead be limited to 40 parts per million. AAP pediatric environmental health experts determined that based on the most up-to-date science, an object with 77 parts per million of lead would be capable of raising a child's blood lead level, if ingested, to a level that would result in the loss of 1 IQ point. Recognizing that most children are exposed to other sources of lead and that it is bioaccumulative, the AAP recommended a two-fold margin of safety and reduced the recommendation from 77 to 40. The level of 40 parts per million was also selected because it fell above the naturally occurring background levels of lead in uncontaminated areas in the United States. The AAP worked closely with Congress throughout the development of the CPSIA to provide access to pediatric environmental health experts and researchers who consulted on several aspects of the legislation. The final bill represented a significant step towards reducing children's exposure to lead, particularly by setting limits where none had previously existed on materials other than surface coatings on children's products. In the January 26 Federal Register notice, children's products containing lead, technological feasibility of 100 parts per million for lead content, the CPSC requested public comment on several specific questions. The AAP would like to provide information on question number 6. What health effects are associated with a reduction of the lead content limit from 300 parts per million to 100 parts per million? And then from 300 parts per million to some other level above 100 parts per million. Based on the AAP's previously noted calculations, an object containing 77 parts per million of lead is capable of raising a child's blood lead level to a level that would result in the loss of 1 IQ point. Please note that this is not meant to be a definitive statement about every child has this effect. Rather, it's a public health statement about the population of children. Individual children have factors that can increase or decrease their vulnerability. For the majority of children, ingestion of an item containing 300 parts per million of lead would result in the loss of almost 4 IQ points. Ingestion of an object containing 100 parts per million would result in the loss of over 1 IQ point. When averaged across even a modest population of children, the public health harm caused by lead is significant, considering that there are about 75 million children in our nation. Impacting 0.5% of all children would mean an exposure of 3.75 million children. Several economic studies estimate that the loss of lifetime income at $1995 of $8,346 for each loss of 1 IQ point. For 10,000 children, that equals $83.4 million. For 100,000 children, it would be 834 million children. For 1 million children, it would be, those are dollars actually, not children. For 1 million children, it would total over $8.3 billion.